Hello and welcome to everyone that's joined us. And as usual, I think I give general odd chit chat to start with, so apologies if you heard any of that conversation. So today I'm really pleased to welcome Ed. That's Dr. Edmund. Do you ever say Edmund?
My parents do, yeah. No, some people call me Edmund, Ed, whatever's easiest. I don't mind either.
Edmund Farrar, who's going to talk about tinnitus. And yeah, I've been speaking to Ed on and off now for the last few months. And it's very interesting because whenever I mention, as I said, Ed, tinnitus to anybody, everybody says, oh, either they've got it in some degree or other, or they know someone. And I'm amazed at how popular is not a great term for the word, but actually how common it is. And I suppose because we haven't got it written, and the usual thing, we don't have it written across our forehead, you don't know whether someone's got it or not straight away.
Yeah, so tinnitus is for people don't know the definition. It's essentially commonly experienced as ringing in the ears, but can take a number of other forms. And you're completely right. It's incredibly common, and a lot more common than people think. So I would certainly call it, an overlooked and underserved chronic condition. In terms of how many people actually have tinnitus, we know that 1 in 8 people in the UK suffer with chronic tinnitus. So that is tinnitus that's incurable. And in terms of the number of people that who are affected by tinnitus, that it has a significant impact on their quality of life, we know it's around 1 in 20. So if you take 100 people, around sort of 15 of those would have chronic tinnitus.
Wow. Well, anyway, before we go do a deep dive into tinnitus, let's just talk. I really like people to introduce themselves so you can do some background and, what made you. The other thing is, please do mention about the app that you have developed as well so people can put it into context.
Sure. Yeah. Well, thank you very much for having me here. It's great to talk, and I'm really looking forward to answering some questions on what's actually a fairly misunderstood topic. So I'm hoping I can clear up some things. So my name's Edmund. I'm a medical doctor by background. So I graduated in 2015 from medical school and immediately joined the Royal Air Force. My plan was to train in both the military and the NHS as a surgeon. But during my time in the military, I developed tinnitus. So thankfully for me, it was fairly mild, and I was lucky. I got used to it quite quickly, and it still causes me problems time to time from sleeping and concentrating in a quiet environment. But it wasn't until I started speaking to men and women in the military that had moderate to severe tinnitus as a result of their occupation. So you can imagine the military, a lot of high risk noise exposure, so firing weapons, engines, that sort of thing. And I realized that firstly, it can have a huge impact on quality of life. And secondly, access to help is very, very difficult. So there's no cure. Effective treatment does exist in the form of something called cognitive behavioral therapy, CBT. The research has shown this time and time again to be effective. But to access CBT on the NHS, and I was referring patients to ENT surgeons, to therapists, and these people were waiting 6 months if they were lucky, a year if they were unlucky. And I thought, okay, well, this is crazy. There's this horrible condition having a big impact on so many people. And they aren't getting the help they need. I've got an opportunity now to use the skills I've learned as a doctor and in the military to create a digital solution that can help tens, if not hundreds of millions of people around the world.
Right, and so with so you said that you got tinnitus yourself. Do you know how you got it? What caused? I mean, is there a specific reason why tinnitus is triggered off?
Yeah, there can be a whole number of reasons. So for me personally, I expect it's a combination of two things. Firstly, I didn't look after my hearing when I was younger, and I used to listen to music. I used to play in a band, play the drums. I used to listen to a lot of loud music, and that's probably not done me a lot of good. And the second thing is I used to and this is very personal and can affect people in many different ways, but I used to wear in-ear headphones for long periods of time, and I think that's just sort of irritated my ears and caused it. But as I said, I'm lucky because it was mild, and it was only really bad for me at night when it was quiet, and if I was in a quiet room trying to concentrate on something else. And I do get sensitive to loud noises as well, which I think is another common thing. But so in terms of the things that cause tinnitus, we can broadly split these into two. Firstly, reversible causes. So this could be anything from an ear infection, earwax can cause tinnitus, or to irreversible or long-term chronic causes of tinnitus. So these are more things like hearing damage from noise exposure, but also old age related hearing loss. So as we get older, our hearing deteriorates, and that can cause tinnitus as well. And the type of tinnitus we're focusing on is of course the chronic type, the type that affects 1 in 8 people. So yeah, there's a whole number of things that can cause tinnitus, but for me, I think probably from not looking after my hearing when I was younger.
And if you look around, I mean, everybody wears earphones now, whether it be just in the gym or just walking around that they've got off the tube, or if we can still do those sort of things. But I mean, presumably tinnitus must have got worse because of this. Everybody has microphones, has it? Or
yeah, I don't think I want to be very clear here. I don't think there's necessarily anything wrong with using earphones. It's people are using them in the wrong way, and especially younger people, I don't think have the necessary protection or education required to look after their ears when they're younger. And when I'm talking about using these things and using headphones or earphones in the wrong way, I'm talking about having a volume greater than 50% for sustained periods of time. If you are listening to music loudly, it's okay for half an hour, but you need to give your ears a break. And if it's sustained, repeated every day, that's the sort of that cumulative impact can start to cause damage. But there is nothing wrong with using earphones or headphones if you're giving your ears a break and you're not using them for too long.
Definitely. And it's a shame because obviously that makes sense, but where are those messages? I mean, and they're very boring messages, especially if you're younger, like, oh, I don't want to turn my music down. You just don't see that education out there, really, do you?
No, you don't. And I think it's one of those things that your parents, I mean, I remember my parents saying to me, turn your music down, you damage your hearing. Shut up, mum. It's just one of those things that, like, as a teenager, you instinctively don't do the things your parents tell you to do, and then you regret it later on in life. But I definitely think that there does need to be better education, for not just young people, but everyone really about protecting their hearing. Certainly in the military, there's been a big culture change. Before, as recent as 20 years ago, there wasn't as much enforced protection, because what happens if you give an 18-year-old a rifle and you also give them hearing plugs? If their mates aren't using the earplugs, then they just won't bother. But now it's actually enforced that you wear earplugs and headphones when you're at the ranges and firing weapons and things. So there is a culture change. And now if you go to a gig or a loud music event, you will literally it's free to get. I think it's actually a legal requirement, I think, to be able to just walk up to the bar and get free earplugs.
Oh wow, gosh.
Yeah.
That obviously shows I don't go to enough gigs or whatever it is, or too blooming old or whatever it is. Okay, so could you just explain, because obviously everybody has tinnitus, presumably. Does everybody hear the same, whatever noise it is? What are the noises, and how does it differ with people?
Yeah, tinnitus is a hugely personal experience, personal condition that affects people in almost unlimited different ways. So my tinnitus is a high-pitched ringing sound that sounds almost exactly like, if you think of any war movie, and when there's an explosion or loud, a bomb goes off or something, after that explosion, there's a high-pitched ringing noise. And that's what I hear, that sort of very high-pitched ringing. But people can hear anything from rushing to hissing to some people can actually hear sort of like a quite sort of musical tone. Some people can hear their heart beating. And it sounds like it's literally coming from in your head, so it's fairly unpleasant. But tinnitus is very personal, and people are affected by it in many different ways, and will hear different things. The most common experience is the high-pitched ringing noise.
And is it? Be interesting to hear your story, but also generally for people. Is it something that suddenly comes on, or is it something that's gradual that you then notice? Do you just wake up and go, "Oh, I've got a ringing in my ears"?
So yeah, you do notice it straight away because it's unpleasant. But it's sort of during I remember the first time I actually noticed it was I was watching a film, and there was a part in the film where it was completely silent. There was no noise, and I thought, what's that horrible sound? It was very unpleasant, this ringing sound. So if you have tinnitus, certainly if you have moderate tinnitus or worse, you definitely notice it. It's unavoidable, really. Any quiet environment, you notice this unpleasant sound.
Okay, so it's order. And I know we spoke about the different types that you were saying about. You can have temporary tinnitus and long-term tinnitus.
Yeah. So as I mentioned, temporary. When there's a number of different ways to categorize the type of tinnitus that you have, and whether it's temporary or chronic is one of the ways to do this. Things like, if you have lots of earwax in your ears, which, there's a problem many people experience, and it's very simple to actually just, you can just put olive oil drops in your ear, which I prescribed to so many patients, which gave them some relief. And when you get rid of the earwax and the earwax comes out, the tinnitus will go. For long-term things, it's more like something that's causing sustained damage over time. So like, if you have a high level of noise exposure over a long period, or if you have repeated infections in your ear, even in very, very rare cases, something like a brain tumor or something like that could cause tinnitus, but that's incredibly rare. And the vast majority of long-term tinnitus is caused by either the noise exposure or age-related hearing loss.
Actually, somebody's just put into the chat. If you could please put your questions into the Q&A, then that's probably slightly easier for me to keep track. But and I will just ask you this question because it sort of works with what we're talking about tinnitus brought on by perimenopause, and does it reverse?
So the honest answer to that question is it depends on a whole number of things. So tinnitus isn't yet fully understood the exact cause and the exact reason it happens, and again, it will depend on the person. It depends on an individual basis. So I've spoken to perimenopausal women that have had tinnitus, and when the menopause, when it eased, and when things got better, the tinnitus improved. But I've also spoken to people with they've had permanent tinnitus brought on by the menopause. So it does vary from person to person. I think it is possible that tinnitus can be brought on by the menopause, but it's not hugely common.
And so potentially that could be just coincidental, but you started going through the menopause and then it happens.
Yeah, and there's so many things that have an impact on tinnitus, and the important thing to realize here is that tinnitus is literally your brain's perception, your own perception of there's a misfiring signal somewhere that your brain is perceiving, and your brain perceives that as tinnitus, as that sound. So it is hugely subjective, and does it reverse? And I suppose so. Perhaps does it reverse is almost the wrong question here. The question could be, does your perception of it change over time? And yeah, absolutely, your perception of it will change over time. And even though it may sound loud at the moment, over time that will change, and as you habituate, that perception will change as well.
Okay, so I mean, one of the things we're talking about, what people get it, and are there certain types of people that get it? Are certain people more vulnerable to getting it than others, or is it just depend more on your environmental sort of your environment?
So we know that age-related hearing loss, there is a sort of a hereditary link, so it can run in families, and if you have age-related hearing loss, then that obviously increases your risk of tinnitus. But this is all about risk. So I think it's really important to clarify: tinnitus isn't a disease in itself; it's a symptom of an underlying cause. So it's in the same way pain is a symptom, or feeling sick is a symptom. Tinnitus is a symptom as well. Hearing loss is a symptom, and it's a problem caused by another condition or an underlying condition that in many cases we don't actually know what that is. We don't fully understand. So tinnitus can if both your parents have tinnitus, I would certainly suggest that you're more likely to be at risk. But that doesn't necessarily mean to say that you're definitely going to get it. It just means the risk of it is certainly higher than it would be if it didn't run in the family. And that's particularly important that you look after your hearing if there's other people in your family that have it as well.
Okay, and so I mean, so we've mentioned sort of ages. So, and I mean, does it present in children?
Yeah, because there's lots of conditions that can cause tinnitus in children. So it depends on what the condition is. It can present at any age, because it's a symptom of many underlying other conditions and other diseases that can cause it. A head injury can cause tinnitus. An ear infection can cause tinnitus. The deafness can cause tinnitus, and those things can all affect children. So it can occur in any ages, and it just very heavily depends on what the thing is that's causing it.
Okay, and so sort of moving on. So there seems to be so many things, and we're going to talk about preventative methods. And I'm thinking, oh my God. Yes, a friend of mine, very sadly, or somebody I know, she fell off a small brick wall basically and hit her head, and that set off tinnitus. And it's like, well, I was just going to say, so how do you prevent it? Well, there could be so many things. But is there any specific things that one can do? I suppose one of them is the earphone type of stuff that we've mentioned. Is there anything else that you would recommend of looking after your ears?
Yeah, so there is a few things actually. There's obviously things that, like a head injury that we can't do anything to prevent. But there's a number of things that we know if you do these things, then you can prevent your risk of either getting tinnitus or your tinnitus getting worse. And the single most important thing here is looking after your hearing. So whenever this applies to everyone. If you have tinnitus, if you don't have tinnitus, looking after your hearing and wearing hearing protection if you're going to loud noise, and it's very easy to buy a set of earplugs on Amazon. If you're going to be listening to anything that's sustained loud noise, wearing hearing protection, or don't listen to music too loudly for too long. If you are in a situation where if you're going to see some live music or something, just go and take a break for half an hour and give your ears a rest. The second most important thing is not sticking things in your ears. So and I've seen this time and time again when I was working in GP, actually in general practice. People would, for understandable reasons, stick cotton buds. Cotton buds are the worst culprits. Stick cotton buds in their ears to clean them. So the skin inside your ears grows outwards from your eardrum. So because the skin grows outwards, it's pushing out all the wax and all the buildup naturally, and it will come out naturally. If you do feel the need to stick a cotton bud in there because you feel there's a lot of wax or there's a lot of buildup, resist that temptation and put an olive oil drop in there instead. It's completely natural. And what olive oil does is it softens the wax, and and it will just come out naturally of its own accord. You just put in a couple of drops every night before you go to sleep, and it will just come out in the shower or on the pillow or whatever, and then, problem solved. Sticking earbuds in your ears hugely increases your risk of infection because they're not sterile. Also, I've seen so many times people coming into A&E with like the end has just snapped off and they've got an earbud stuck in there. It's not very nice. It's quite easy to take out, but it's not very nice. But it just hugely increases your risk of any irritation around that area, around the infection, and that can cause, that can lead to tinnitus. So yeah, two things I would say: look after your hearing, wear hearing protection, and don't stick anything in your ear. And that applies for everything. Fingers, earbuds, cotton, well, anything. Sorry, earbuds you can put in, but anything that goes further in to try and clean or anything. If you look online, you will see all sorts of essentially bogus claims that people are making, that companies are making about this will cure your tinnitus. This will relieve your tinnitus. And this can be anything from like sticking onions in your ears to actually putting candles in your ears. And, this is all rubbish. If it sounds too good to be true, if there's a company making a claim of some natural remedy of sticking something in your ear and getting rid of your tinnitus, it's not going to help.
So is that the earwax thing? I mean, that because that was something. Is that what they used to do in the olden days? Because pour hot wax or something in it. What was it they used to do?
I'm not sure about that, but there's these things called I don't know how. I think they've actually been used for quite a while. But there's these things called ear candles, and the idea being is that you stick them in your ear, you stick them in, and then you light the candle. I don't think I need to go into the reasons why this is just a terrible idea. Hot wax, a dirty candle being stuck in your ear is going to cause you so many problems, and it certainly won't help your tinnitus.
And then olive oil, is that just like standard olive oil that you cook with?
Yeah, you can use extra virgin if you're feeling generous to yourself. But yeah, olive oil. Yeah.
Yeah. Oh, okay.
You can just put it in like a pipette, or you can buy like a syringe or something on Amazon, and you can just you put in a couple of drops. You can just put in a couple of drops every night, and that will soften the wax, and it will come out after a few days of use. 99.9% of cases, it will solve the problem for you.
So, and then so we talked about preventative things. So let's talk about the management. Okay, we've got it. It's established. We've got it. And one thing that we haven't spoken about would be quite good if we could talk about the mental health side of it, because I think it's all very well saying we've got this noise, but we haven't actually mentioned yet that the terrible toll that it can take on you mentally, and that's the most important thing, is to try to get on top of that, I believe, to manage it.
Yeah, completely. Well, actually, the most important thing for people here that have tinnitus is to ensure that you've seen a doctor before trying anything or doing anything, because there are a few things that can either be reversed fairly simply. They might need to look in your ear and there might be an infection there, or there are some slightly more sinister causes of tinnitus, very rare, but it's just best to check, to be seen by a doctor to make sure that you don't need a scan of the brain or something like that. I don't want to alarm anyone. These things are incredibly rare, but we need to be safe here.
And a GP is fine to go to a GP for this.
Yep. So if you have tinnitus and you haven't yet seen your doctor, go to your GP. I know it's difficult in current circumstances, but it's just you need to be assessed, and it's so important before you try anything. You need to if you have tinnitus that's affecting you, you need to see a GP. I really, really strongly recommend that to anyone here. I've forgotten the second part of your question.
So two things really is, how do we manage it, and then also the mental health side of it as well.
So the management, it's a fairly varied plan, and it will depend on the thing that's causing tinnitus. If there's something reversible, then the doctor will do something to treat that. If it's something like hearing loss or age-related hearing loss, or you've got tinnitus associated with a hearing problem, then a hearing aid will often provide you with some tinnitus relief. If you don't have hearing loss, or you have hearing loss and when it's not something reversible, the next step is, what we call psychological therapy. So there are a number of these psychological therapies, primarily cognitive behavioral therapy, which have been shown by numerous scientific studies to reduce the impact of tinnitus on your life and help you get to what we call habituation. Habituation is the point, tinnitus habituation is the point whereby you can still hear your tinnitus, you don't notice it as often as you used to, and the sound isn't unpleasant anymore. It's not impacting your life. Habituation can take, if you don't have any help, habituation can take quite a long time. It can take years, but what psychological therapy aims to do is shorten the time it takes to get to habituation, the point at which tinnitus is no longer impacting you and you're having a normal life. And one of the things that, so I've mentioned going to see your GP. I will caveat that by saying that many people are told by their GPs, sorry, there's nothing reversible here. There's nothing that can be done. That is not true. So I really want apart from the going to your GP first, the second sort of takeaway message here is there is something that can be done. There is help available, and there is support out there for people with tinnitus. And it is entirely possible to live a normal life, even if you have severe tinnitus, without your tinnitus impacting you. So that's habituation. And these psychological therapies are up until very recently were delivered through either an audiologist or a psychologist, talking therapy. And they teach you cognitive tools and techniques to train your brain to react differently to the sound. I'll give you an example of that. If you wake up in the morning, your tinnitus is loud, the instant reaction to someone with newly diagnosed tinnitus is going to be, oh no, my tinnitus is so loud, my day's ruined. I can't have a normal day today because my tinnitus is so loud. And that is a completely normal reaction to have when you first have tinnitus because it's so unpleasant. But what CBT trains you to do is it trains your brain to react differently to that and think, yeah, it is quite loud today, but it's not going to change anything in the long term. It's not going to go away. It's not going to get me stressed. It's not going to ruin my day. I'm going to have a normal day. And you just don't react to it in a sort of that negative spiral that you would have done before. And CBT is great for that. It's very effective. And we know it's effective because there've been numerous research studies done to show that it's effective.
And so what does the CBT, is that like a course that you would go on, or?
Yeah, so so CBT can be delivered through a number of modalities. Traditionally, I said face-to-face therapy. The National Institute for Healthcare Excellence, the recommending body for healthcare practitioners, doctors, and audiologists, now recommends digitally delivered CBT as first-line treatment. And this is where Otto, our app, comes in. So we wanted to, the problem is that there's not that many people that are trained to deliver CBT for tinnitus, but there's lots of people with tinnitus. So we wanted to balance that out and provide a scalable way for anyone to access these cognitive tools and techniques, this tinnitus support whenever they need to. So we've built all these tools into a mobile app that is delivered through recorded audio sessions. And what the app does, with a time with a face-to-face therapist would do, it trains you to stop noticing your tinnitus like you did before and stop reacting negatively to it, with the goal of habituation. It stops tinnitus having an impact on your life, and in a far cheaper way than a far more accessible way than time with a face-to-face therapist would be. So face-to-face therapy, on the NHS, you can have as little as two sessions, 2 45-minute sessions with a therapist. It can, you can get 3 or 4. If you pay privately, you can be seen for 3 or 4 months by a therapist to teach you these things. But, with Otto, you have unlimited access to this recorded audio program. And, we've made it as close a representation of face-to-face therapy as possible. you'd use it very much in the same way you'd use Headspace or Calm, 5 to 10 minutes of recorded audio session each day. And, it feels like you're being spoken to. We understand what it's like for people with tinnitus. We understand what it's like for you. We've translated that into what I think is a very personal and human experience.
But this isn't a sales plug, by the way, is it, for your product? Because we're just talking about, that's why you've got into it, to really help, because you understand the issues. Now, I think the point that you've said is the accessibility, because surely if you're having, like you wake up and you're having a bad day, like we all have bad days about anything, you've got a bad day, particularly with tinnitus, it's something that if you know that you can reach to straight away, that starts calming you down straight away, I would have thought.
Yeah, I mean, the accessibility problem is why we did this in the first place, because it is literally so hard to get help through your GP, through a therapist. Private therapy is available and readily available, but it's actually prohibitively expensive for many people. So it was really important to us to create a scalable solution that can be used by healthcare professionals around the world, and can be used by individuals to provide that help at the touch of a button when you need it. So yeah, it's I'm very conscious. I don't want to talk too much about Otto. I'm sure we've got many questions, but if anyone wants to try it out, just send me a message or send me an email. I'm very happy to tell them more about it. But yeah, I'm sure people have got plenty of other questions about some non-Otto related things.
So I was just thinking, so the management techniques, well, we've sort of spoken slightly. We've spoken about the management techniques. Yeah,
so it's so the CBT. So there's management techniques that you can get from a therapist, and there's management techniques that you can use yourself. So there's a number of things that you can use to train yourself to reduce the impact of to stop noticing the tinnitus, basically. And the first thing that I would recommend people doing is actually mindfulness and meditation. So mindfulness and meditation, if done in the correct way, is actually been shown to be a really, really positive tool that can be used. So you can access this through any number of ways. I mean, we know the main apps: Headspace, Calm. We've got meditation training in Otto as well. And what's important is that when you're doing this meditation, traditionally, if you're using Headspace, you'll have a sound on, and there won't be any sound whilst you're doing the breathing or anything. And silence is uncomfortable for people with tinnitus. For those of you with an iPhone, there's a really cool feature called background sound. If you go into settings and search background sound, you can turn on a background sound, ocean, fire, cicadas as well, I think. There's a permanent sound on in the background, and that stops that silence from being a problem for you if you're using something like Headspace or Calm. And I think Android phones have a similar feature as well, similar accessibility feature. And if not, there's certainly something that you can download with that. So the first thing I'd recommend is mindfulness and meditation, after you've seen your GP, of course. The second thing I would recommend is really getting used to breathing exercises to stop you from feeling stressed. So one of the first things we train people to do in Otto, and this is something I would recommend for everyone to do, is learn how to slow your heart rate down and to stop yourself feeling stressed using deep breathing. Well, many people have experienced this, but what happens with tinnitus is that you hear your tinnitus and it's an unpleasant sound, so it stresses you out, your heart rate goes up, and that stress then makes the tinnitus worse. It's a negative spiral. You get more anxious, your tinnitus is louder, you feel worse, and after a few hours you feel really, really dreadful. And you can start to train yourself to interrupt that negative spiral and stop yourself from feeling anxious using deep breathing exercises, some of which you'll learn in mindfulness and meditation. But a simple one would be breathing in for 7 seconds and breathing out for 12 seconds, and doing that 5 times. Anyone with an Apple Watch or a smartwatch, you can literally just tap a button on here, and it will tell you how to do that breathing exercise. So that's a really, really important thing that I sort of, these two things I've mentioned so far, people think, is that it? Is that really help? Yes, it does. And it's something that if you practice it and you do it every day, it will help and it will reduce the impact of tinnitus on your life, and it's been shown to be effective. The third thing I would say is don't lose hope and don't give up. So when you first have tinnitus, when you're in the early days, it can be so isolating and unpleasant, and you literally feel like you're on your own and there's no one, nothing that can help you. But again, that's not true. It is entirely possible to live a normal life with severe tinnitus, and it's just getting to that point. And you just, unfortunately, it's one of those things you just have to be patient with. And if you do all the right things, exercise regularly, I'll come back to exercise actually, exercise regularly, do the breathing exercises, access therapy in whichever way you feel is more appropriate. If you want to see a face-to-face therapist, you can either access this privately or through your GP, maybe a bit of a wait, or you can, there's a number of digital tools that you can use as well to access these therapeutic things. So what have we talked about? Mindfulness, breathing, trying to stay positive, not giving up hope. And the fourth thing I would say is, diet and exercise. Again, exercise in particular is so good at helping you to reduce stress and coping with things in a better way. So even if that is just like a 10-20 minute brisk walk outside on your lunch break or in the morning, it's just a great way to clear your head and a really good way of coping with stress. And it reduces the impact of tinnitus on your mental health as well. So, just going outside and getting some fresh air there's actually lots of research that's been done non-specific to tinnitus, but to show that just going outside and getting fresh air has a number of positive benefits. It might not feel that way, when it's cold outside in the winter and things, but do try and really force yourself to do it, because it does help in the long run.
Well, we've got quite a few questions, so we'll go through those. But I think what you've said will make lots of people feel positive about it. And it's interesting that you say that it's a lot of the things that are simple that really make the difference. And I think everybody's thinking some hugely complicated thing, or pop a pill, which is obviously, that everybody goes, well, if I can have a pill, a magic pill, it all goes away. But it's as normal with chronic conditions. It's learning how to manage it, having the patience and being dedicated to it. And the question I was going to ask, and I suppose it's how long is a piece of string? How, if you start, you discipline, because I presume you've got to discipline yourself to get into the habit of doing these things. How long would it take to start seeing results? Could you say?
Not specifically to an individual, no. It can vary hugely. What I can say is that, if you are going to start feeling better very quickly if you're exercising every day, you're meditating every day, you're doing your breathing exercises when you're feeling stressed, and you're eating healthily. Regardless of how loud your tinnitus is, that's going to make you feel better after a very short space of time. The one caveat I would have to that is if your tinnitus is having a big impact on your mental health and you need further support. So, if you have like depression and anxiety as well, that's when you might need further help with that. And that's why I think it's important to go and speak to your GP about this before you try anything, before you try and self-manage anything, because if your tinnitus is actually having, if it's stopping you from sleeping or having an impact on giving you really, really bad anxiety, that's when you might need a bit more help than these sort of self-management things as well. So there's one other thing I actually haven't mentioned yet, which I really think is important to mention. So one of the first things I expect you'll do when you hear this ringing noise, it's very unpleasant. You go and see your doctor, you get told, well, sorry, there's nothing that can be done. You say, okay, right. Tinnitus cure, you'll Google tinnitus cure 2021 or tinnitus treatments online. You have to be so careful what you read online, because I can guarantee you now, if you Google tinnitus treatment, one of the ads that you see at the top it'll be something like a dietary supplement or a tablet that you can take. There is no tablet that will improve tinnitus symptoms. There isn't. It's just that they don't exist. And any company or online pharmacy or anything that is trying to convince you otherwise is lying, and they're taking advantage of you, and they're trying to get you to pay for something which doesn't have any scientific evidence to back it up. So if you have any doubts about something you found online and you want to check whether it's valid, I would strongly advise anyone to go to the British Tinnitus Association website, and there is a list. They have a traffic light system of things. They say, is this treatment safe? They have all the treatments. They've got literally, I think, like 50 or 60 treatments on there, and all the drugs. Is this treatment safe? Green light, yellow light, red light. Is this treatment effective? Green light, yellow light, red light. And actually, if you go through every single one of these treatments, cognitive behavioral therapy, CBT, is the only one that has a green light for both.
Wow. So, well, that's like invaluable advice, because we're all desperate when when we've got a problem, we're suddenly faced with it, we want to find an immediate solution.
Yeah.
And that's really great advice to go to that.
Yeah, I mean, I could sit here and rant for hours about these. These companies are, they drive me mad, because they are literally taking advantage of people and when they're at the time of need, and I think it's terrible, really. But just
and you're vulnerable.
Exactly. Yeah. People want help, and there is help out there available, but just don't believe everything that you read on Google, because there's just so much rubbish on there. And some of these people some of these websites will mislead you as well. They'll say, like, scientifically, but it's not. It's not. The way to check that is to go to the British Tinnitus Association website, with the traffic light system, and that will tell you.
So the best thing, go to your GP, make sure there's not some other underlying cause, a serious cause that could be affecting your tinnitus, and then
or a reversible cause, or something that could be treated.
Yeah, and then go down the path. Okay, let's go through some of the questions that we have here. My tinnitus is aggravated by eating dairy. Is this common?
The honest answer to that question is, I'm afraid I don't know. But there is certain things that can aggravate tinnitus, and a really good thing you can do is to double check that, is to stop eating dairy. And I suppose it sounds very simple, and I expect you've all tried it, but stop eating dairy for a while and see what happens. I think it's quite, everyone. I love certain dairy products, but there is very good alternatives available out there. So I think it is possible to not eat dairy. I would try it for a good few months and see what impact it has.
I'm currently recovering from an ear infection caused by trapped water after swimming. I'm coming to the end of my antibiotics, but still have constant tinnitus in the affected ear. Until now, it was only occasional. How long will this last, and how long should I wait until I speak to my GP?
So, first thing, I'm sorry to hear that's happened. I know how frustrating it can be with trapped water, and it can cause infections. So that is a common thing. I can't give specific medical advice, as a doctor here, but as a general rule, I would say, if tinnitus is still causing you a problem, I would just go back and book an appointment, see your GP. But I'm really sorry. I hope you can understand I can't give medical advice for specific scenarios. But yeah, it sounds like in that situation, it would be a good idea to book an appointment.
If tinnitus is still disruptive when you have background sounds on, are you using the wrong sounds, or does it not work for everyone?
Well, no. I mean, it sounds like you're using the wrong sounds. So there are a number of apps that you can download and try that give you access to hundreds of sounds. And the key for you is just trial and error, working out what works. So for some people, different sounds work, other sounds work, and you can literally just go through the sounds, play around with the volume as well. Make sure that you're getting it, so you can actually literally just at the point where if you turn the volume down, you can hear your tinnitus. If you turn the volume up one, you can no longer hear your tinnitus anymore. But use of sounds to relieve tinnitus is something that does require some experimentation at times. And even if you think you have found the best sound, I would encourage people to keep looking for a different sound, because some are a lot more pleasant to listen to. We have over 100 sounds in our app as well, if you want to give that a try.
Okay. I've annoyingly got many chronic health things going on, some of them being investigated, some being relegated for later. I'm a musician and have tinnitus. I've had it for about 8 years. I'm on about 11 different medications, maybe 6 have tinnitus marked as possible side effect. I also didn't do that great at ear protection from the get-go in loud music, which was 30 years ago. And the health things are along the lines of undifferentiated connective tissue disorders and nerve issues. I've been told there is no way to isolate the cause of tinnitus. How could I best find tinnitus support? It's getting harder to make music, if nothing else.
Yeah, hi, Kath. I'm sorry about your situation. It certainly sounds very difficult. Again, it's fairly difficult to sort of give you a specific answer to this without giving you medical advice. But I would say in general, I think this is a conversation that you need to have not just with your GP, but also the doctor that may be managing the other conditions. So these other conditions that you have, these chronic conditions, there may be different drugs that you can try and experiment with if that's something you've tried. But I think next time you have an appointment, a sort of a follow-up appointment to discuss with your consultant or whoever that may be, the specialist that's managing these other conditions, or if it's your GP, then your GP. So yeah, rheumatology. I would definitely raise it with them if you haven't done already. If tinnitus is a side effect of these medications, then changing the medication can often actually improve the tinnitus. Yeah.
I mean, is that common that tinnitus does cause medication can cause tinnitus?
Yeah, there's a number of medications that can cause tinnitus. And what often happens if we stop the medication, the tinnitus resolves. So, Kath, I'm sorry. So, Kath just said they can't support. Yeah, I think again, it's again difficult to provide a sort of a helpful answer, and I'm acutely aware I'm probably not being very helpful here. So I'm sorry about that. But I think it's a conversation that you just need to reiterate to your GP that if your tinnitus is bad, you need to go back to see your GP and tell them that. There's a sort of an overtone here of a lot of, I don't want to sound like I'm palming you guys off to see your GPs, and I know how difficult it can be to see your GP at the moment. It's really, really difficult. But unfortunately it's just the problem that we're in at the moment, the situation we're in at the moment with the National Health Service. It can be so difficult to get help. But from a medical specific perspective, then that's what I would suggest doing.
Thank you. And don't worry, I think everybody recognises you can't give a specific prognosis or advice directly. Yeah. I know, and especially as you're very much front line with secondary care, you're there to give that answer, and that must be frustrating as well for you. Right, I have a deviated septum. Here we go. A blocked I don't know how you pronounce it. EUS.
Deviated septum, blocked eustachian tube. Yeah. I can see it. Yeah. So.
Okay.
Who is this from? This is from Margaret. Hello, Margaret.
We're not meant to be saying people's names.
Sorry. Didn't know. So hello to this person. Deviated septum for blocked eustachian tube for over 2 years and tinnitus. Are these connected? Again, I can't tell you. I can say non-specifically, eustachian tube disorders can cause tinnitus in general, but in terms of your specific case, I'm afraid I don't know. It certainly could be.
Yeah, she's saying the direction of sound causes problems for her, so that must be very difficult. You hear a sound, but you don't know where it's coming from.
Yeah, and it can be very unpleasant. So I understand that.
Okay, I think this may be one of the last ones. I'm currently recovering from an ear infection which caused partial hearing loss and constant tinnitus. Until this, I only had tinnitus occasionally, so it's quite distressing. So did we have this one earlier? The infection was caused by trapped water after swimming, which I never considered.
Yeah. So again, trapped water can cause tinnitus, and the most important thing here is to make sure you're getting support from your GP as required. I would refer you back to the things I mentioned earlier for sort of general self-management things that people can do with long-term with sort of permanent tinnitus, long-term tinnitus. making sure you have the right medical support from a medical professional, the meditation, the deep breathing, the positive, and the sort of sticking with it, and keeping out these things, and of course making the lifestyle changes.
Thank you. Well, I think that's it on the questions. But I think before we started talking, you said it's very difficult because everybody is slightly different. So everybody's got a slightly different potential answer to what their question is.
Yeah, and it is everyone, and that tinnitus is such a personal experience, and there'll be so many different causes and ways that people experience tinnitus. And I just want to reiterate, I'm sorry that I haven't been able to provide people with specific advice to them. As a doctor, I have to be very careful about offering medical advice. In my current sort of position, in my position, although I can talk about tinnitus generally, and I can talk about tinnitus advice and things that people can do generally, I can't offer specific advice because I'm not an ENT specialist. I was a general doctor. And that sort of specific advice has to come from someone that is in the right position to be able to give you that advice. So either a GP or a specialist, and that's sort of another word of caution as to looking at things online, because people will be very, very, especially on forums, people will be very happy to offer you medical advice on forums, and you don't know who that person is, you don't know whether they're trained to be offered that advice. I'm not in a position now to be able to give you guys specific medical advice, but I can give you overall advice. I can give you tips and things that you can do that hopefully can apply to your situation. So I hope that makes sense.
No, absolutely. And I think you've given people a direction where to go. You've given people that when I say you've given people hope, you've given people not hollow hope, but actually there is tangible things and steps that one takes. You see your doctor. It's interesting that you said that it's quite hard to get your doctor to help. So a lot of people may have already gone down the doctor path and said, oh, it was a complete waste of time. But as you said, well, that's a very common reaction because they don't know all these other things that are actually out there. So
yeah, so I think the key there is you have to be the GPs nowadays are so busy, and this isn't correct, and maybe this isn't a fair reflection, but because they don't have a lot of training in tinnitus and how to manage it, sometimes you have to just reiterate. And my advice would be, in general, for people struggling to get buy-in from their GPs, is you just have to tell them how much it is causing you difficulties. And the other sort of really good place to go is the British Tinnitus Association website. So they have a confidential helpline that you can I think you can either chat or you can actually call them as well. The BTA do a great job. British Tinnitus Association do a great job of help and support for people with tinnitus. And if you're looking for sort of general support and advice, then I would suggest people go to their website and get in touch with them.
Right, and go and have a look at Otto. So we have got your link is on the webinar details, so please have a look. So thank you so much for coming. It's just been really, really, I think, I said to you before, we've had a lot of people have emailed in saying, they're sort of at their wits' end with it all, but I think you've certainly given people a structure to go and look at and see. And thanks, Kath, for saying that she's found that the breathing really does help. So thanks a lot. Thanks, everybody. Cheerio. Bye.
Thank you, everyone. Bye.